I'm George Galloway, and I present Kalima Horra on Al Mayadeen television. Here we are in London. I speak my words freely, either in Parliament, on television, here on the streets of London. Kalima Horra means free word. That's what I speak. So Kalima Horra is a two-way conversation. Check it out on Al Mayadeen television. Welcome to Kalima Horra with me, George Galloway, on Al Mayadeen television, coming to you from London, but discussing an issue of world importance. Of that, there is no doubt. 1 million people have died already from the coronavirus. Here in Britain, the number of cases is spiking dramatically and frighteningly, although it is not yet clear the extent to which that will lead to increased hospitalizations. Up to a point, they have already begun to happen, but whether the health service will be able to withstand any substantial increase in hospitalizations, and not yet morbidity, death on the scale of the original outbreak earlier this year. At the same time, one would have to concede that there is a revolt underway in Britain. It's not yet, of course, the majority in the country, but a substantial and increasingly vocal minority are at the stage now with the coronavirus that they cannot accept any further restrictions, lockdowns, social distancing, with all the accompanying mental health issues that are associated with those, and the opportunity cost, if you like, the lack of attention to other ailments, illnesses, conditions that is necessarily paid because so much emphasis is going into the issue of the coronavirus. At the same time, we in the West, at least, are desperately praying for a vaccine, or at least some of us are, because there is a lobby also in Britain and elsewhere in the world that is either afraid of vaccines or deeply distrusts them. There are vaccines, of course, already on the international market. I myself am hoping to take live on air somewhere a Russian vaccine in the very near future. There's a Chinese vaccine. There's a Cuban vaccine. We will not be allowed to take vaccines from China. We must pay the pharmaceutical companies in Britain and in the United States vast sums of money, and must wait many months, perhaps spring of next year, in order to get the protection such as it is offered by Western vaccines. Mind you, Donald Trump, when he rose like Lazarus from the Walter Reed Hospital, later claimed on Twitter that his blood was the vaccine. Even Donald Trump was embarrassed by that one and promptly deleted it from Twitter. So we're waiting for Godot. We're waiting for the vaccine. Will it do any good other than to the bank balances of the companies that produce it? And if not the vaccine, what else? Because I think it's fair to say that the revolt to which I referred earlier is only going to grow and grow. I have, as always, a distinguished panel of experts here in the studio and on screen, all with differing, perhaps wildly differing, points of view. And because this is Kalima Horra, we believe in free speech. Everyone will have their say. Let me ask you first, Dr. Ranjeet Brar. You're a doctor, you're a surgeon, you have taken a consistent line on this. First of all, how do you feel about this revolt that's growing? And secondly, why are we still waiting for a vaccine, and will it be efficacious when it comes?
Thanks, George. I think that was a great introduction, but it touches on lots of slightly adjoining but not entirely synonymous themes, and that's why I think people can seemingly have such widely differing points of view and dispute apparently the very facts we're talking about. Because overlying this whole issue are on the one hand a medical issue. Is this virus real? Does it really represent the threat we are told it does? On the other hand, is it the cause or the sole cause or even the main cause of all the economic problems that the world is currently facing? And those are overlapping questions. And then what is the best health approach in general? And then as part of that, what's the best health approach to this virus? And I maintain, and I have maintained, that it's not necessary to shut down. As you quite rightly say, we are reducing the overall service provided by our National Health Service. And because of greatly reduced capacity, when each time a health crisis comes, we find ourselves unable to give the service we would like to our patients. If we come then to the question of the virus itself, is it real? It is real. It's a surprising thing to think about that such a low overall mortality. But still, if we look at the figures, probably we are talking about 1%, perhaps in excess of 1% mortality. That means 1 out of 100 people who get the virus will die. That's low mortality. If I tell a patient they've got 1 in 100 chance of dying in an operation, but 99% chance they make it through for a serious condition, the vast majority of them will accept those risks. But when, of course, that's one individual person. When you talk about the population of the world who can be exposed, 1% of the world population becomes huge figures. And that's why there's, at the same time, a lot of people feel very safe and it's not a serious problem. But equally, if you simply allow the virus to run rampant through the population, it could be responsible for, Holocaust. In terms of the actual number of deaths you're talking about is massive. And we know
well, it would be the best part of 1 million in Britain alone.
Absolutely.
750, 800,000.
Absolutely. And so that's why there are such kind of widely differing emotions that it's caused. In terms of the length of time it's gone on, we've seen that some countries, those who have mounted a health response where they have put the economics and the health and the policy at the service of the interests of their population. And regardless of their economic system, though, I would argue that if you look at the economic systems that have done best, they're clearly those who are socialist. There are different models of socialists. People argue about whether they're socialist. Those who essentially have a model where they think they're socialist, where they put the interests of the people first, they've done much better than actually the free market fundamentalist nations who deliberately have adopted a policy of not really looking after the health of the population, but always in all matters first considering the bank balance of the most wealthy section of the population. And so when you put all of those contending factors together, you see that the best approaches have in fact eradicated the virus without any need for a vaccine before we even come on to the subject of today's debate, which is the utility and efficacy of vaccines. And of course, we can talk about that. But China, the Koreas, even Australia, Vietnam,
New Zealand,
provinces within India of all places where
Kerala, a socialist state within India, India having been one of the worst afflicted parts of the world, has a remarkable success rate because it's followed the kind of health policies that you're describing.
I think that's exactly right. And so that essentially with good healthcare measures, which is really tracking, tracing, we're sick of these words now, tracking, tracing, diagnosis. So seeing where the virus was very early on, developing widespread testing, and then appropriately taking those people who had the virus and are at risk and actually socially isolating them, which is what China did and published very early on in February and March. I had a document in my hands, which was a blueprint of how to deal with it. And none of it's changed. And that was published by China in English and in lots of languages, disseminated around the world, and studiously ignored by our government, political leaders, and I'm afraid our medical establishment who are under their tutelage as well. So they ignored those measures. But they didn't use a big app in China. They didn't have an app that the people distrusted. They had small teams of local community health doctors, nurses, and workers who went to the families of those who had been tested positive, worked out their contacts, explained to them that they were at risk, provide facilities where they could go, actually like hotels where they could go, be monitored, tested. When they became clear of the virus after several tests, they were allowed to go back into the community, not a risk to the community or themselves. If they became unwell, they were transferred into hospitals where they were taken care of very well and received the best care available at that time. And yet still, initially, there was a spike in deaths. They didn't know what they were dealing with. You could understand it at the time. But actually, China, through that means, limited the spread of the virus to less than half of 1/100th of 1 percentage point of their population. So a tiny percent of the population of China had the infection, and they eradicated it. And so, with,
Yes, we'll come on then to the vaccine, of course. But Louise Creffield is the director of SORUK, an anti-lockdown measure group. You're an author and an activist. Louise, thanks for coming on to Kalima Horra. What did you disagree with in what Dr. Brar said?
For me, I like to look at the whole thing, especially here in the UK, because, you know, SORUK stands for Save Our Rights UK, and therefore, while I recognise that it's a global issue, I understand the UK system, and I recognise that the measures that the government are taking, and also their power grabs and the things that they are doing that are undermining the well-being of the nation. For example, they've used the lockdown and they've used coronavirus to take away rafts of protections from children in care homes, elderly people in care homes, and then also people who have got mental health issues and children who are living in poverty. And for me, you can't just narrow the focus to COVID and corona. It's not enough, because there are so many other issues that are brought in. And as has just been said, it highlights the issues that we have in this country. We have so much poverty, we have so much homelessness, we have so much disparity between the rich and the poor and the classes, and it's just the whole point of lockdown. And I'd always say I'm a pro-rights group rather than an anti-lockdown group, because what I'm not anti is I'm not anti protecting those that are the most vulnerable, you know, and really I believe that we should have been doing that from January. We knew there was something going on, we knew it had the potential to come here, and the country acted too late, as far as I'm concerned, in protecting the most vulnerable, putting in measures to safeguard and shield those that have health issues and underlying health issues. As we all know, those are the ones that are most afflicted by COVID. And I know what this government is like. I have a history in politics, and I knew from day one that they were going to use this. You know, the way they sold off, they got rid of all of the NHS debt. They changed the law so they no longer have to advertise for 10-year NHS contracts. So therefore they can just give it to any private enterprise that they choose. You know, it's going to destroy our NHS, and it's the impact upon our NHS by just focusing on COVID this year, and the waiting lists that are now extending by years, the people that are going to die because they're not getting cancer treatment, and all of these delayed operations. You know, if we want to protect the NHS and if we want to save lives, we've gone the wrong way about it, because we're actually killing people. It's killing people left, right, and centre, and it will continue to kill people for many years to come. You know, the government actually published an impact assessment report that said for the next 5 years, there'll be at least around 12,000 excess deaths per year because of lockdown measures. And I think that's a gross underestimation, to be honest, because that's not taking into account poverty, that's not taking into account alcoholism, addiction, and so on and so forth.
If you ended the lockdown tomorrow and abandoned it, none of these other issues that you are rightly addressing would automatically be improved.
No, we're at this point
so why not campaign for more investment on those issues rather than abandoning the lockdown and social distancing and so on?
Well, as I say, I would say that we're a pro-rights group. Save Our Rights is the name, and we want human rights to be upheld. So we want, you know, the right to life, the right to family, the right to privacy, and so on and so forth. And so that is what we want. We want all of those areas improved. We don't want poverty. We don't want homelessness. And you know, we proved that we can house all of the homeless in this country like that overnight. They did that, and then they put them all back out on the street.
All back on the street, yeah.
And it's you've just got to wonder what they're thinking.
We'll come back to you. Dr. Siyana Shaffi, you also are a doctor, a general practitioner. You're the founder of Kitrinos Healthcare. You've worked with refugees. You know the global situation. How does the prospect of a vaccine, some months distant, at least 5 months distant, but perhaps a year distant, How does that seem to you?
It is important that the science is understood. I think, for me, I think as a simplistic person, I would probably think of most films where an outbreak scenario, for example, the happy ending, the happy ever after, is a vaccine. A vaccine, someone just jabs themselves, they've found themselves to be immune, they go and inject that into other people and everyone's sorted. And you're right, it's not as simple as that, because obviously with the production of vaccine, it's the preclinical trials and then 3 phases of clinical trials, which basically means we experiment on each other as human beings. The numbers get larger. And then the bit that I think most marketing companies don't tell us about is the post-marketing surveillance, which is where we then test it on the general public. And I think we'll be lucky if in a year from today we have a vaccine.
Why is that, though, when Russia is already vaccinating its population and, in fact, offering at cost price to other countries like Venezuela and some countries in Africa? So far, this vaccine has proven robust. Why must we wait for SmithKline Beecham or AstraZeneca? Why must we wait for them to come up with a vaccine? Why can't we all use, as I'm going to, the Russian vaccine?
We can, if you believe that the vaccine is going to be efficacious enough and it will kind of seroconvert you to produce the antibodies. You know, for me, as again a generalist, I would say there are always side effects which may not be imminent. First of all, you hope that it works, and second of all, that it doesn't leave you with something more devastating in time to come. I think the only comments I've come across for some of the testing that's gone on already was one of the vaccines was pulled out of trial because it was causing inflammation of the spinal cord, for example. So, which is right. And I think in this scenario, it's not about who produces the vaccine. It's about trying lots of different varieties, and good on the Sputniks, you know, if they've managed to get that one out.
I mean, you say it's not about who produces it, but it is precisely that for the British and American governments. They will never allow China or Russia to clean up the market for vaccines.
You say that, George, but you see, when we were going through the PPE thing over the last 6 months, when we ran out of PPE for our NHS staff in the UK, at some point, I'm pretty sure, and maybe our surgical colleague can confirm, those masks that our staff were wearing came from China.
Well,
they did.
The former Industrial Revolution Centre, Great Britain, can no longer make little pieces of cloth masks. Let's go to the United States to get an international perspective on this. Dr. Kevin Barret, PhD, is a radio and television broadcaster of note there. Dr. Barret, welcome to the show.
It's good to be back with you.
Can we expect a fair distribution of a coronavirus vaccination if and when it becomes available?
We really don't have any good information that would allow us to know precisely when there will be a vaccine available for whom and where, whether it will be safe and effective. Indeed, whether a safe and effective COVID vaccine is even possible. And this is just a microcosm of what's going on with a larger COVID-19 crisis. There are far more questions than answers. As far as whether we should expect a vaccine anytime soon, normally most experts would have said no. And the reason for that is that there has never been a successful vaccine for any coronavirus, including SARS and MERS, which are vastly more deadly than COVID. And had there been a viable vaccine, there should have been a strong effort to make one for those if you could do a vaccine for a coronavirus. So there's that open question about whether such vaccines are even possible. And that's why the rush to get this vaccine out is so strange. To me, the important thing about the COVID crisis is that it has obviously had a whole series of effects that would have been desired by the likely perpetrators of this. If indeed it's a made in a lab virus, it has transferred trillions of dollars to the richest people. It has destroyed the middle class. It has created a global reset to usher in a cashless society, to usher in mandatory vaccines, to usher in universal surveillance under cover of contact tracing, and so on and so forth. These were all on the wish list of the people that run the world, just like all of the measures that 9/11 brought in were on the wish list of the people who run the world before that false flag event happened. So given all of that, if COVID was indeed made in a lab and deliberately released, which I think is about a 98% probability, then theoretically there should have been some work towards developing some kind of vaccine or countermeasure, because normally you don't unleash a biological weapon unless you have a countermeasure. The United States government has released biological weapons countless times, waged massive biological warfare on North Korea, on Cuba, on Angola, and so we know who the usual suspects are here. And the real question then is who got the head start on the vaccine? If somebody did, if there is a vaccine that comes out, it probably was from someone with a head start. And the Oxford effort is the top suspect, because biological warfare suspects from the United States are working with that Oxford vaccine. So I would put my money on Oxford in this race.
Is there a race? I mean, even a vaccine war with all these competing interests trying to get the vaccine first?
Yes, of course, we are seeing an ostensible race for the vaccine. But as I suggested in my previous answer, that race has probably been rigged. So we do have all of these players in the big pharma germ warfare complex jumping in, the biosecurity complex. They're jumping in and trying to make billions and trillions of dollars on this. We do have some government socialist outfits as well in China and to some extent in Russia. But basically, this kind of crisis, as Naomi Klein writes in The Shock Doctrine, is always about making big money for the big players who need to shock populations into accepting measures that will be immensely profitable to the billionaires who have created the shock. That's what COVID is really all about. And so the pharmaceutical industrial germ warfare complex that is massively profiting off COVID is the big winner here, regardless of whether a safe and effective vaccine is in fact developed.
Well, there is the pure serum of conspiracy theory. We'll take it apart after the break. Stay tuned. Welcome back to Kalima Horra. Well, before the break, we heard the pure serum of conspiracy theory. It's made in a lab, it's been deliberately released, it's a bioweapon, and the people who released it are the people who are pushing for what has come to be known as the Great Reset. I could speak for hours in reply to that. But that's not the kind of show we are. Dr. Ranjeet, I wish I was as sure about anything as he was as sure about everything, but he was sure that it was 98%, not 97 or 99, but 98% likely that this was deliberately released, that it was a bioweapon, and the good folks of Oxford were probably to blame. He didn't think there could be a vaccine, but he was absolutely sure if there is, it's going to be a vaccine profited from by these biotechnology companies, pharmaceutical companies that we talked about earlier. Now, what this plays to, I suspect he's a professional, how shall I put it, controversialist, but it plays to an audience that so distrusts government, the state, and for very good reason, that governments and the state have consistently lied to them about the Iraq war, about any number of things. It's playing to that audience, which is a growing audience, as you and I both know.
When you look at a problem and you grasp certain facts, it doesn't necessarily mean that you put them together in a way that enables you to grasp the real picture or indeed find an adequate solution. And that's a real problem being raised for probably tens of millions of people across the world at the moment. We do live in a world where governments, many governments, particularly the most powerful governments on earth, cannot be trusted precisely because they represent the interests of a tiny moneyed elite whose wealth and privilege is built upon essentially the negation of the interests and rights of a vast mass of humanity. But the answer to that is to have a real political leadership and a real political movement amongst the masses to reorder those things which are wrong in government, in society. It's not to selectively grasp facts and make a conspiracy that there are certain individuals who are just remaking and reshaping society against us and everything's against us. So this concept that the virus is a bioweapon, I'm 99.9% certain that it's not. Now, what's my certainty based upon? It's based upon my understanding of the way in which disease has lived with humanity and evolves, and viruses in general, and coronaviruses, by studying them in particular, it's quite clear to ascertain that it's not a bioweapon. A bioweapon you'd think would be more lethal and more selectively deployed than rather deployed against your own population. It's not in the interests of capitalism to engineer a massive depression, quite the reverse. It is a serious problem, and therefore serious measures should be taken by governments to fight it. Of course, if a tiny group like our own government in this country, who advocated herd immunity and quite clearly within their own governmental meetings, the meetings of state, have advocated the idea that herd immunity is the way forward. What do they mean by that? Let it run rampant through the population, protect the economy. If a few pensioners die, so be it. They don't care about human life.
I think they used
care
even
about
those
money.
exact words.
Exact words. And that was the highest level of our government in this country. That was their values. But it doesn't mean it's not a real problem. And they balked when they saw the number of people who were likely to die, not because there was a conspiracy and they'd engineered it and released it in a controlled way. They hadn't. When a crisis comes, unquestionably, they will use any crisis to try and push their own agenda. As we all try and pursue a path in life, they've quite clearly set out theirs, which is to protect the interests of the mega wealthy individuals and corporations within our country and in the planet. That is their path. It's not the path of the working people.
That's a brilliant response, a very educated one. I've got a simpler question. How is it in the interest of capitalism to destroy the market, to render scores of millions of their people unable to afford to buy the goods and services that capitalism wants to sell them?
It absolutely is not. I mean, what you can say is out of every crisis, the majority lose. So many businesses will go to the wall, especially the smaller businesses, but even medium sizes, even large businesses. And out of that wreckage, as long as that system remains in place, there will be a winner. So there'll be someone who then snaps up the market and gets a relative monopoly share. But that is not, it doesn't cause stability within, to have huge numbers of unemployed. America suddenly has 57 million unemployed. What that really shows is they had a lot of partially employed and precariously existing population before. But to have them suddenly unemployed, destitute, angry, that's not in the interest even of those who are extremely wealthy and doing well. They're extremely worried about the precariousness that this situation creates. So it's not in their interest to create crisis. It's that they can't avoid them as long as they carry on ploughing that economic furrow.
Louise, you're the closest thing we've got in the studio to a skeptic. I don't want to caricature your position. You're the only one in the studio that wasn't wearing a mask. I'm inferring that you think that masks and so on are an exaggerated response, or at least an inefficient response. What did you think of the testimony from the other side of the Atlantic?
I think the main thing to recognise is that people are going to profit from this. There are profits to be gained from this, and we've got to look at where it's going and if that is really in our best interest. And as has just been explained, the big companies are going to snap up all of those small pubs, you know, like there's going to be a few big companies that will take up all like the pubs that are about to go under because they're being shut again. And, you know, there is going to be companies that are going to take the monopoly out of this. And we've just got to really be mindful. And what we're campaigning for at Save Our Rights is to actually change the whole lot, so change the system. So we want a real democracy. So, because the political system currently is run by the corporations, really. You know, the MPs are kind of beholden to the corporations and they do their bidding. So that needs to go, you know, as does the banking system needs reforming, as does taxation, as does the healthcare system so that it's not beholden to big pharma. And then, as far as I'm concerned, education needs reforming because our education system does not encourage free thinking and thinking outside the box. And so our children don't grow up to be like entrepreneurs and to really explore other ideas other than what they're kind of fed. So as far as I'm concerned, that's our ultimate goal at Save Our Rights, because all I can see is that we are owned and controlled by these corporations in all areas. And until all of those areas are reformed, we're not really going to be free. We're not going to have autonomy. We're not going to have privacy. We're not going to have a government that we can trust. We can't trust. Like, would I go as far as the previous person from America? No, I wouldn't. I wouldn't go that far, but I don't trust. I don't have trust in the government and I don't have trust in their interests, that they've got our best interests at heart. And therefore, my issue with things like masks, for example, is I'm all about freedom and freedom of choice. I fully support anybody who wants to wear a mask, who feels better with a mask. If they've looked at the science, you know, it does say on the WHO guidelines that it may increase your personal risk of catching COVID.
But it will decrease yours. If I wear a mask, I'm less likely to give coronavirus to you.
If you have it. And if you have it, I'd say stay at home. So, you know, like that's...
But I may not know I have it.
That's if he knew he had it.
Yeah, exactly. Yeah, no, I agree.
It
but
may still be gestating. It may be that I'm asymptomatic.
Absolutely. But, you know, there is an element of it increases your potential personal risk. And we have seen cases go up since they were mandated. So you've got to question their effectiveness. But my issue there is the mandating of masks is the issue, because that disproportionately discriminates against disabled people and it disadvantages them hugely. Disabled people now do not like to leave the house because they get abused in the streets and in shops. They get refused entry. The people who cannot wear masks are disabled people.
But your policy is that the most vulnerable in society should be locked away for their own protection, and the rest of us should go about business as usual.
No, they should have the choice. They should have the choice to stay home if they want to stay home. Because I actually know a lot of my, one of my very best friends is a mental health nurse for the elderly people, and their referrals have gone through the roof. They don't want to live like this. They would rather take the risk and see their families and have hugs with their grandchildren than be locked away. And because they're like, we're going to die at some point anyway. I'd rather live until I do. And they don't want to be shielded. But for anybody who does want to be shielded, we should be able to do that. We should support them in doing so. And anybody who wants to wear a mask should be supported. But a lot of the disabled people that can't wear masks are people with autism and with post-traumatic stress disorder. These aren't people who are more at risk of coronavirus, but they cannot wear a mask for personal reasons. And where those people are being asked to highlight their disabilities and like display that with some lanyard, which is like the gold stars back in Germany, you know, and then they're getting abused in the streets, and we can't support legislation that does this to our vulnerable in society.
Could I respond?
Well, let me go to America first, and then I will, of course. Sure. Jeremy Hammond is in Michigan, USA. He's an independent journalist and political analyst, and a publisher and editor of Foreign Policy Journal. Jeremy, welcome to the show.
Thank you.
Are you a conspiracy theorist?
No, not at all. In fact, I very consciously avoid conspiracy theories, and I try to stick to things that are really uncontroversial, even though the topic itself that I might be discussing is very controversial by nature. I really just try to stick to the hard facts and data.
What concerns do you have about the forthcoming coronavirus vaccines?
The main concern that I have is the insufficiency of the vaccine approval process itself. So it's not just the COVID-19 vaccine. I mean, people are worried about this because of Operation Warp Speed and just the fast tracking of this particular vaccine. But all the vaccines, the pre-licensure trials and studies are really insufficient, and to be able to determine what those long-term effects of a vaccine are, you really need long-term studies. You need randomized placebo-controlled studies with comparing not just short-term, I get redness and maybe a fever or something, but long-term harms, long-term consequences that might not be anticipated at all. And so the only way to do that is to do the proper studies with long-term, comparing health outcomes, including mortality, between vaccinated and unvaccinated individuals. And so vaccines don't go through that kind of study.
Who will benefit from coronavirus vaccines if and when they become available? Will they be delivered en masse?
No, there's talk about that in the literature, and then they talk about who should get it first, because it's not going to be immediately available to everyone. And so they want to try to prioritize, obviously, the high-risk groups. But then there's a problem with that because from what I understood, they had adults in the trial, but not elderly adults, which is strange because, that would be the when you think of the high-risk groups, it's elderly people with comorbidities. And so, number one, they exclude, they include healthy people in the trial. They don't include people with underlying conditions. And then also, are the studies actually applicable to that age? So there's this translational failure where the population under study isn't the same as the population that would actually get the vaccine once it's mass marketed. So we need to be very careful about that. And so that's kind of a weakness of some of these trials, as far as I know, that they're really not including necessarily the populations that would probably get the vaccine first.
What will happen, indeed, to some extent, it's already happened, that vaccines emerge not from Western big pharma companies, but from abroad. Why can't we use those?
I think to some extent that's, there's a political issue there. For example, the Moderna vaccine has been supported with, I don't know the numbers, but, very probably in the billions easily of dollars from the government. The National Institutes of Health is funding their trials, is funded. In fact, the government owns patents related to the vaccine technology that's used in the Moderna vaccine. So the government is very heavily involved in that and has an interest. It literally has a stake in the success of that vaccine. So, there's certainly that's going on in the background.
Is there any truth in the conspiracies that circulate around the personalities of Bill Gates, Melinda Gates?
I'm a little bothered by some of the conspiratorial discussion related to Bill Gates, because there's some people who believe that he actually was involved in creating them, that the virus was manufactured in a lab and he was involved in that and deliberately releasing it to, these kinds of crazy theories that. But there's no question that Bill Gates is heavily involved in this. That he is. Right now, he's the WHO's biggest funder. The Gates Foundation is the Bill and Melinda Gates Foundation. Moderna is funded by Bill Gates. He's funded their development of the mRNA technology that's used in their vaccine. And he's just pushed for mass vaccination globally. And it's, for example, pushing for the DTP vaccines in developed countries, despite the best evidence that we have showing that vaccine is associated with an increased rate of childhood mortality. He's definitely a big player in this, and he's got his tentacles everywhere. There's no question about that.
Dr. Shaffi, for someone my age, it is very difficult to understand the anti-vax movement that seems to have gathered steam. When I was a child, many other children had polio. They wore metal calipers on their legs. Some were in iron lungs, a fate which used to keep me awake at night. It was nightmarish, positively nightmarish. Polio has been eradicated almost entirely in the world by vaccination. I was, and all of my 6 children have been, routinely vaccinated against measles, mumps, rubella. I've had anti-cholera vaccines and so on. And so now I find, at my ripe old age, that there are academics who clearly ooze anti-vax sentiment. You're a doctor. Do you understand that?
So as I became a GP, I was going through that era when there was a rise, particularly in the UK, of the anti-MMR because of the link with autism and inflammatory bowel disease, for example. So a lot of my patients coming to me during that time were very much anti-vaccine and saw me as a pro-government advocate for vaccinations, filling the pockets of those who make them. But I too, like you, I've vaccinated all my 5 children. And I think you asked the question about, you know, if you're going to get your Sputnik vaccine for COVID-19, go for it. Because putting my hat on, so I have 2 hats. I have my regular GP hat, but I am also the founder for a charity where the welfare of some 20,000 refugees in a very sort of small camp, a very overfilled camp that recently burnt down in Lesvos, was my concern. And actually, during this time, since the pandemic, we manage on a shoestring budget. I'm the biggest investor in my own organisation. You know, I bought our first ambulance that ran the mobile clinics, and we really kind of hit rock bottom almost every month. Things changed during the COVID-19 pandemic. You know, so what I want to say is there are some good people out there, and they have been sending us PPE. They've been sending us, they've been helping us to make masks on site. You do what you can, right? So I think it is about leadership, which you mentioned. You know, the bottom line is we need to find leaders who believe in simple things and not necessarily profiteering. And as a GP in this country, I've actually, from my own locum company, so I'm a locum GP now, I had to give up my partnership to run the charity. I'm actually, furloughed. I'm furloughed. So I didn't have work to do as a GP because the hotspot centres where all the other locum GPs were working were the only places. I've just turned 50, so I'm actually, and I'm, you know, from the background where I will be at high risk. So that would have been the only jobs I would have been able to do. And I definitely wasn't going to go.
This question of leadership is key, isn't it? I mean,
think so.
If we had leaders that people believe in, then you can beat this thing. Absolutely. And that's our biggest weakness, isn't it?
I think so. I mean, there is no leadership in any capacity whatsoever. There is no...
Well, the 2 worst countries in the world are Britain and the United States, who have the worst leadership in the world.
And I work in, so my work at the moment is mostly in Greece. And if you remember, it actually it was one of the best in Europe during the height of the pandemic, just because of simple things. They did the contact tracing. You know, so even boats of refugees coming across were tested. They were tested more than my colleagues here working in the NHS.
Yes, quite. Look, let's hear from another remote guest, George Solomon. I remember well from the anti-war movement. He was a soldier in the British Army who walked out on the army because he opposed the British government invading and then occupying Iraq. He's still in the health field. He was a Royal Army Medical Corps man even back then. George, good to see you again. Will the distribution of vaccines be fair if and when they become available?
No. Pharmaceutical industries, basically, I mean, to put it bluntly, they see this as a cash cow. So they're all looking at this as an opportunity to make a large amount of money. But the more dangerous thing, I would add, is that they feel or think that the government's going to give them a free rein just to bring out a medicine. And all medicines have side effects. Now, a normal vaccine would take 5 to 10 years. This vaccine will be pulled out in less than a few years. Now, what side effects it will have could be worse than the illness itself, kill thousands. And now I'm not against vaccines. I've had the flu vaccine myself this week. But what will happen when this comes out? It's such a short notice, so quickly. Will we have deaths in 10, 20 years' time from this vaccine? It's a bit worrying, I think.
Is profitability a factor in determining if and when a vaccine becomes available to the mass of the people?
I can speak for the UK. I know that our government itself has already made legislation that in the future, people who take this vaccine will not be able to sue the pharmaceutical industry for negligence in terms of side effects. So with our own government, they're planning on rolling out a vaccine as soon as they can because it will make vast amounts of money. So, I mean, sadly, I would assume that China as well as Russia also have the same attitude to making profits.
The reason we know each other is because you, like me, and you were a soldier, concluded that the government's case for the war on Iraq was based on falsehoods. This is another war of a certain type, and there is a pushback against the government's narrative on the issue of the coronavirus. To what extent are these two things similar?
The virus does exist. It is part of being human that viruses do happen. Yes, I agree that maybe the government is taking advantage of it, but they're not just taking advantage of it in terms of reducing our freedoms, but they're taking advantage by placing contracts with their friends in the pharmaceutical industry, placing contracts with organizations for the testing, which are private, when they have these facilities within the hospitals, which are state-owned. They're making a profit out of it. There's no doubt our government is making a profit. If you look at the cabinet, virtually every one of them has shares in private medical companies that contract out to the NHS, and virtually every one of them is making some money out of it. That's a fact. I mean, you have to be naive not to know that. And if you deny it, then you're denying reality.
It's not, in fact, a fact. If it were, it would have to be registered in the parliamentary register, and I can assure you that that last fact was not a fact. And this bedevils this whole debate. People think they know facts that are not facts. They infer from facts that were not facts a whole series of hypotheses, and even someone like George, whom I remember as a good egg, are so distrustful of our government, of our state, of the motives of the people involved here. Bill Gates, I've got no animus or otherwise towards him, but he's spoken of in the way that Rothschild is, as a kind of demonic figure. This is a real crisis, I think, Doctor.
I think it's interesting. I think very much of characters like a lot of people, when they look deep into any particular question, just as the miners looked into the press at the time of the miners' strike and realised there was some kind of conspiracy against them, because what's in the press is not what they're seeing in front of them. They're being beaten off the picket lines every day, and they're being portrayed as the aggressor and the problem when they're defending themselves. So people start to get an inkling that something's fundamentally wrong in our society, but they're seeing a pale reflection. They've had a lot of the political tools robbed from them for really understanding what's going on. A lot of the political leadership robbed from them for understanding what's going on. And what they're really seeing when they're getting a hint of a conspiracy is they're seeing the conspiracy of wealth against the rest of the population. But they're not analysing it as that. They're not saying this is actually, you know, this is just the normal economic workings of our society. This is monopoly capitalism. This is what they're all hinting at. When they look at Bill Gates, you know, what you're seeing is anyone. It's a bit like if you look at the Lord of the Rings. They talk about, you know, anyone who has enough power wants to use it to do good, but they can't. It's just too much power in the hands of an individual. If you're one of these 6 people who have as much wealth between them as half the planet's population, it's impossible. Bill Gates must think of himself as someone who wants to give back, who wants to give as much to the World Health Organization as individual nations. You know, and between them, these billionaires decide when wars happen and don't, what's invested in and what isn't, what's in our economic priorities and what isn't, whether we get healthcare or not. You know, they're constantly looking, because they are capital personified. They can't help but constantly look for their companies to keep on making profit. And they make profit by constantly, unfortunately, impoverishing the mass of humanity. And people that you've had with you have seen glimpses of that. But glimpses and not seeing the whole picture can be extremely dangerous because it gives a kind of false consciousness, a mistrust, a sense of unease without any presenting political solution that actually humanity is in command of its own destiny, that actually humanity, if it has a problem, can solve it. If humanity, needs to find a solution to a problem, it can. And vaccines do work. It's a 200-year-old technology that's been proven extremely effective and was one of the few arsenals in modern medicine that was absolutely uncontroversial until a few years ago. It's concentrated wealth in the hands of a tiny minority and poverty to a huge, vast mass of the population. We produce more than we need to eat, yet the world is starving. These contradictions we see all around us, and we see it in the health industry too. And people are rebelling against that. They see the injustice, they want to change it, but they haven't adequately diagnosed the problem. The problem is not one individual, it's an economic system.
I so wish we had more time to explore these issues. This has been a fascinating program for me. I hope it was for you. I've been George Galloway. This is Kalima Horra on Al Mayadeen Television.